Inguinal hernias are swellings in the groin, which tend to appear usually when a patient strains or coughs, and sometimes is easily visible on standing. It's more common in men, as men have an inherent weakness where the spermatic cord comes out of the abdominal wall. Most patients will present with some discomfort when they have a hernia. And once again, this discomfort is usually on exertion or on playing sports. There are very few patients who can have very severe pain, which is a potential, which shows that there's a potential risk for either the hernia getting trapped or obstructed or getting strangulated. However, this is quite uncommon, as most patients will present with some kind of discomfort or an achy feel. There are, however, some small soft hernias, especially in elderly men, which can be left well alone and they would not cause any problems. There are two main ways of repairing hernias. One is the laparoscopic or the keyhole method, and the other one is the traditional open method. In the laparoscopic method, a small cut is made in the belly button, and with cameras, a mesh is placed in the lower abdominal wall to strengthen the musculature. While in the open method, a cut is made directly over the hernia, and a mesh is similarly inserted, once again to reinforce the weakness in the muscle wall. My personal preference for open hernias is to use a mini-incision. However, for bilateral hernias on both sides, I would use the laparoscopic keyhole method, as I can repair both these hernias through the same incision. Now, as far as this single hernia is concerned, I use a small incision, approximately 3 centimeters, through which I insert what's called as a lightweight mesh to strengthen the wall. The advantage of a lightweight mesh is that it forms less scarring, there's less pain, and in my hands, a mini incision has fewer complications, and patients recover much quicker and are able to get back to normal activities comparable to a keyhole method. Normally, it takes about 4 to 7 days to get over the wound healing. And so there's some discomfort associated, and one would not advise anyone to undertake any exertion or any active, any heavy lifting. However, within 2 weeks, once the wound pain has gone, one can resume normal activity as soon as they wish. That also includes sports like running, tennis, and golf. The repair itself is strong from day one. So I advocate patients to start their normal activity as soon as they can.